Brazil, one of the worst countries when it comes to dealing with the pandemic. A COVID-denying president that promotes social gathering both inland and offshore. COVID patients dying in hospitals. An oxygen crisis hits the largest city in the Amazon rainforest. The Minister of Health, under investigation, keeps pushing an ineffective drug to the general public. Vaccination starts, and the anti-vaxxer president comes up with another elixir that allegedly cures COVID. A former president is back in central stage. This is Brazil, not for beginners. The COVID disaster, part 2. Hi there once again, I'm Nelson Garrone. I'm an independent journalist here in Brazil. This is the second video I make about the COVID-19 crisis in my country. Foreigners have tried to grasp what is going on here, so have we. How did we turn out to be one of the worst countries when it came to planning a pandemic response? If you haven't watched the first video, I kindly invite you to do so. I described how the Brazilian administration reacted since the very beginning of the outbreak until New Year's Eve, when oddly many Brazilians found reasons to celebrate. In this video, I talk about the dawn of 2021 and the worst moment of the pandemic so far. Unfortunately, that can be updated anytime soon. In early 2020, the president had made a forecast for the crisis. The year before, the H1N1 flu had killed 800 Brazilians. According to Bolsonaro, the coronavirus would kill less than that. 800 people. On the 7th of January 2021, Brazil reached 200,000 deaths. A week later, a crisis broke out in Manaus, the largest city in the Amazon rainforest. The local health system had run out of oxygen supplies. COVID patients or anybody in need of an intensive care unit were desperate. Hospital beds had turned into asphyxiation chambers, doctors said. Weeks earlier, local entrepreneurs, business owners and COVID skeptics had refused to accept a lockdown. We want to work, they shouted in downtown Manaus the day after Christmas. Under pressure, local authorities gave in. Social distancing measures were halted in Manaus. As a result, COVID cases rose sharply. 2 weeks after the protests, the health system collapsed. City mayor and state governor failed to prevent the calamity. But what about federal authorities? Well, curiously, the health minister had been in town 4 days before the crisis. And what did he do? He recommended the useless COVID kit. If you don't know what the COVID kit is, do watch the last video. But in summary, it's a combo of drugs that allegedly cures COVID, something that only exists here in Brazil. Now we know the only oxygen provider in Manaus had warned the health ministry the city was on the verge of running out of oxygen. Emails were sent to the ministry. There was no reply. Instead, the federal government came up with a unique solution. On the day of the oxygen crisis, the health ministry launched an app to help doctors in the early diagnosis of suspected COVID patients. The app basically suggested the prescription of an anti-malaria drug to everybody, nauseous babies, children in general, and even pregnant women. Regardless of the symptoms, one drug was prescribed: chloroquine, a medicine that at that time had enough evidence that it did not work against the new coronavirus. What caused the oxygen crisis? Disregard for social distancing measures, the nonchalance from authorities that had been warned about the lack of oxygen supplies? Not according to the health minister. Eduardo Pazuello blamed high air humidity and lack of the so-called early treatment. Yes, he blamed a city in the middle of the Amazon rainforest for being too humid. He was apparently surprised with the humidity, the moisture in the city in the rainforest. The rainforest. And the early treatment he talks about is another name for the COVID kit, a treatment with no scientific proof whatsoever. When the oxygen crisis was imminent, the Ministry of Health even sponsored an entourage of doctors to go to Manaus and present the pseudo-miraculous drugs to local physicians. The decision not to impose a lockdown in the city of Manaus allowed a Brazilian variant to develop. The city of Manaus was very likely the place where P1 variant emerged, with its 17 mutations. How did Brazilian experts find that out? Well, actually they didn't. The new variant was detected in Japan. 4 passengers had been in Manaus days before and contracted it. Brazil has not been keen at all on testing, let alone finding out if a new variant comes up. Abroad, authorities are extremely worried about the so-called Brazilian variant. In the UK, for instance, newspapers showed the effort to stop the infection by this more aggressive strain. Here in Brazil, mass testing is not even discussed among senior government health officials. The anti-vaxxer federal administration suffered a setback in mid-January. The vaccine developed by China's Sinovac and sponsored by the governor of Sao Paulo was approved by Brazil's sanitary agency, the equivalent of America's FDA. For the ones who haven't watched the last video, the governor of the state of Sao Paulo, João Dória, is currently Bolsonaro's political arch-rival. No sooner had the vaccines been approved than Governor Dória set up a stage and promoted the first vaccination in Brazilian soil. Dória was all over national news. Immediately his approval ratings went up. Bolsonaro's fell. Fake news industry, aligned with Bolsonaro, intensified its criticism to the vaccine as it was manufactured in communist China, despised by the far-right groups, even though China is Brazil's main trade partner. In this meme, the right-wing Governor Dória is seen wearing panties embroidered with a flag of the People's Republic of China. Does it make sense? In real world, it doesn't, but who cares? Bolsonaro followers also spread news that vaccines don't work, or worse, kill people. They kept defending drugs with no proved efficacy, including the anti-malaria drug, a medicine against head lice, an antibiotic, vitamin D, and zinc. You can also see many fake news about alleged new studies that attest that masks increase the risk of developing lung cancer. Yes, masks beget cancer, according to President supporters. By the end of January, pressure was mounting against the federal government. Federal prosecutors opened investigation against the Minister of Health for the oxygen crisis in the city of Manaus in the rainforest. Meanwhile, Bolsonaro had his eyes elsewhere. The National Congress, not to defend its closure anymore like he did the year before. On the 2nd of February, both the lower house and the Senate would choose their speakers. Both are elected by their peers. More than ever, Bolsonaro was interested in having 2 allies in those very strategic positions. Under the Constitution, the Speaker of the lower house is the one who decides to accept or not a petition for a presidential impeachment. There are over 60 petitions to oust the current president. Therefore, Bolsonaro's presidency relies on Congress and most importantly on the will of the Speaker of the lower house. How would Bolsonaro secure the election of his allies? Well, he used a common resource in Brazilian politics. He granted over $500 million of public budget to MPs. In exchange, Bolsonaro made sure his allies would be the next speakers of the lower house and the Senate. Bolsonaro's health minister was still under scrutiny. In addition to an inquiry in the Supreme Court, he was summoned to explain the oxygen crisis to congressmen. Eduardo Pazuello stated he had not been aware that the city of Manaus was short of oxygen supplies. We cannot forget he was in town days before the tragedy and his ministry had received emails from the only oxygen supplier in the city of Manaus saying they were literally running out of air. In a statement, the anti-vaxxer president said he had never been against the vaccine. By now, you know, that is an absolute, how you call it, well, a lie. He had been boycotting the vaccine for months. Remember? He said that it wasn't safe and it could turn people into alligators. But in addition to boycotting the vaccine, the federal administration cut funds for ICU beds. despite the growing number of cases. Unlike the year before, Brazil's carnival was officially cancelled in 2021. Crowds ignored health measures though. Among them, the president, who showed up at a beach and attracted dozens of followers. Two weeks later, unsurprisingly, COVID cases escalated. In the beginning of March, Fiocruz, one of Brazil's most renowned health research centers, made an estimate of how much the new variant had spread across Brazil. Fiocruz made tests in 8 states, and in 6 out of 8, P1 variant was already the dominating strain. If you add the number of people in the 6 states, you come up with a population as large as the UK's, almost 70 million people. I should remind you that Brazil's internal borders are open. Anyone can travel anywhere within national borders. For the first time since the beginning of the pandemic, the situation worsened in every corner of the country. Both the number of cases and deaths rose sharply. Despite this shocking scenario, Bolsonaro's supporters were still adamant. In São Paulo's main avenue, a group gathered to protest against social distancing measures. An actress walked by and filmed the rally. For wearing a face mask, she was called a slave of communism. Escrava do comunismo! Bolsonaro's denial did not succumb to reality. In a video in his official channel here on YouTube, he laughed when talking about a headline that showed that the suicide rate among youngsters had risen. He said that he had never been wrong when predicting the consequences of the pandemic. We must remember that he said that the coronavirus would not kill more than 800 people in Brazil, that it would be a little flu, a little cold, and that an anti-malaria drug would cure COVID. But who cares about accountability? On that very same night, Brazil hit its record in COVID deaths. More than 1,900 dead in 24 hours, almost 2,000 people dead in one day. And that was the president's reaction. The pandemic was in its peak, yet the president was still completely nonchalant about the severity of the crisis. Bolsonaro even mocked patients that ran out of breath. Bolsonaro told Brazilians to stop being cowards, stop whining, and asked us when we would stop crying.
Chega de frescura, de mimimi. Vão ficar chorando até quando?
To supporters, he said that the press and social media were complaining about the lack of vaccines. There are no vaccines for sale in the world. Just in your mother's house. Let's remember that Bolsonaro personally refused to accept 70 million doses of Pfizer's vaccine in 2020 and boycotted the joint venture between Butantan Institute in São Paulo and China's Sinovac to manufacture a vaccine in Brazil. Bolsonaro came up with an alternative solution though. He sent an entourage to Israel, the country with the highest vaccination rate in the world. But the official visit had nothing to do with vaccination. The senior delegation would meet experts behind the Israeli-developed nasal spray against COVID-19. The spray had only been tested in a group of 30 people. Before taking off, the team took a picture with President Bolsonaro. Nobody wore masks. When in Israeli soil, the COVID deniers wore face masks, complying with local laws. Talk about double standards. In a meeting with his Israeli counterpart, a local official reproached Brazil's foreign minister for not wearing a mask.
We need it with a mask.
And in another meeting, while the Israeli Prime Minister was wearing 2 masks, the son of the president, MP Eduardo Bolsonaro, failed to wear his mask properly. No nationwide social distancing measures, slow vaccination, federal government and its supporters defending drugs with no efficacy, and more recently, the nasal spray. No wonder the Director General of the World Health Organization stated that the situation in Brazil should be taken seriously and that the more lethal variant of the virus could spread to the rest of Latin America. He suggested Brazil adopted aggressive public health measures. That very concern came up in a Washington Post editorial. The article states that what happens in Brazil does not stay in Brazil, and quotes a renowned Brazilian epidemiologist, Professor Miguel Nicoleles from Duke University. He warns, quote, "If Brazil does not control the virus, it will be the largest open laboratory in the world for the virus to mutate," unquote. In the worst moment of the health crisis, a plot twist. Lula, the former president, the most renowned Brazilian leader abroad, was back on the political center stage. A Supreme Court judge struck down Lula's convictions that prevented him from running for president in 2018. This made international news. In his first public appearance, Lula criticized the current president's denial and urged people to wear masks and get vaccinated.
Tome vacina.
A few hours later, President Bolsonaro showed up wearing a mask himself and publicly defended vaccination. Odd. Political pundits here in Brazil almost unanimously agree. The abrupt change in Bolsonaro's behavior had one explanation. Lula was his virtual rival in 2022's presidential election. Bolsonaro slowly started to defend vaccination and brag about his administration's effort to buy vaccines he once downplayed.
Sempre afirmei que adotaríamos qualquer vacina.
Yet he kept criticizing social distancing measures and did not stop defending drugs that allegedly cured COVID. The health crisis in Brazil was in its worst phase so far, with almost 300,000 confirmed deaths. Under pressure, Bolsonaro decided to oust his health minister. Eduardo Pazuello ended up being the scapegoat for the government's omissions, mismanagements, incompetence, and wrongdoings. But we know that Pazuello had always worked under Bolsonaro's scrutiny. His moves were closely watched by his boss. The official health policy was developed and managed by Bolsonaro himself. Pazuello had no autonomy whatsoever. To Bolsonaro, a new health minister would be a breath of air. Pardon for my metaphor. That's what he did. The first candidate, Dr. Ludmila Hajar, was dismissed after it became clear she was against the pseudo-miraculous drug and defended lockdowns under certain circumstances. The plan B was Dr. Queiroga, a cardiologist. In his first quote after being appointed, the new health minister stated the health policy would be developed by the government, not by the minister himself. In the announcement of the new minister, the president failed to accept any mistakes regarding his government's COVID policy and even commended the former health minister, Pazuello. Bolsonaro ensured the new minister would carry on with the ongoing policy. In other words, one of the worst countries when it came to dealing with the pandemic, and the president changes the health minister but is unwilling to change his disastrous policy. 21st of March, Bolsonaro's birthday. What did he do? Promoted social gathering and incited a coup. Again. They are pushing it too far. Count on the armed forces for democracy and freedom. I'll do anything for my people. We will not dive into socialism. So what will happen to Brazil? The future is bleak, according to health experts. By now, we are fully aware of how the virus behaves, and we are still trying to understand how the new variant works. And what will happen to Bolsonaro? Well, the Attorney General has already opened 9 inquiries against him. But in Brazilian politics, the main source of concern for any president is always Congress. Only lawmakers can oust a president. For the time being, despite the fact that Bolsonaro belittled the seriousness of the pandemic, supported drugs that don't work, boycotted social distancing measures, fostered public gatherings, verbally attacked China, condemned vaccination, despite all that, in the worst pandemic in Brazilian history, Bolsonaro is safe as long as he still holds majority in Congress. I told you, Brazil is not for beginners. Please share this video and subscribe to my channel. Thank you very much indeed for watching. So, what do you want to know about Brazil? Tell me in the comments below. I'll happily try to explain. It's hard, counterintuitive, I know, but it'll be a pleasure. See you next time.
Mas eu quero que o senhor saiba.
I want you to know I'll give my life for you.
Vida pelo senhor. E não é
This is not fanaticism. No, it is not fanaticism. I'm a conscientious lady.
E não.
Every time I see you crying, it
Eu
hurts.
vejo o senhor chorar. Isso dói.